We will be beginning in a couple of minutes. All right, Tracy, I have 2 o'clock if you want to get us rolling.
Yes, thank you all for joining us today. We are here for another week of updates from the local health department regarding COVID-19 across the Lake Cumberland district. We have some members of our executive team here that will be answering some questions. I also want to say, if you have questions during the meeting, if you want to type those in your chat box, we'll do our best to answer those today. Sean, do you want to share an overview before we start answering questions?
All right, fine. I will be turning sideways here to read our update board. There's been 120 total cases in Adair County, 19 deceased, 84 recovered, 17 current active cases, 14 of those on home isolation, 3 in the hospital. There's been 21 cases in Casey County, 0 deaths, 12 recovered, 9 active, all on home isolation. 6 total cases in Clinton, 0 deaths, 5 recovered, 1 active case, home isolated. 6 total cases in Cumberland, 0 deaths, 6 recovered, no active cases. 5 total cases in Greene, 1 deceased, 3 recovered, 1 active case that is self-isolated. 18 cases total in Macquarie, 0 deceased, 15 recovered, 3 active, all in home isolation. 94 total cases in Pulaski, 2 of those deceased, 81 recovered, 11 active, all on home isolation. 46 total cases in Russell, 4 deceased, 33 recovered, 9 current active cases, all on home isolation. 43 total cases in Taylor County, 1 deceased, 30 recovered, 12 current active cases, 9 of those are home isolated, 3 are in the hospital. 15 total cases in Wayne, 0 deceased in Wayne, 11 recovered, 4 current active cases, and they're all on home isolation. So we've had a total of 374 cases in all, 27 deaths, 280 recovered, 67 current active cases as of yesterday at close of business. 61 of those isolated, 6 in the hospital. I was going, and so far today we have 7 confirmed new cases, and we've got a few more cases that are being investigated, or situations that are being investigated that might turn into new cases. So it's looking like we may have another worst week. I went back and looked for Sunday through Tuesday, ending the 16th of June, we had 10 new cases during that time period. For the Sunday through the Tuesday, that ended on the 23rd, or that occurred on the 23rd, we had 17 new cases that week. So through yesterday, we've had 17 cases, and today so far, as I said, we've got 7 that we know about and some more that we're investigating. So it looks like this week could again turn into another week of increases for us. If you look on our website, at the chart for either new cases or active cases, you'll see our growth curve was really sharp at the beginning. Then the economic shutdown, the drop off, there was a valley. And then around Memorial Day, things started opening back up again. And about 4 weeks later, you can see the curve is really sharp increase again. I think my planner, who is not in the room right now, says she did the calculations, and I think we've had she said it's over a 600% increase in cases since Memorial Day. So a lot of growth since then. Fortunately, our hospitalization rate isn't as high as it was early on, and our mortality rate isn't as high as it was early. So those are good things. You can just Google hospital capacity COVID-19, and you can see in places all over the United States, of course, most urban areas, hospital capacity is becoming an issue again. And, maybe that will never happen in Kentucky, since we're smaller and more rural. But as the public health director, I don't have the luxury of being a skeptic. It's my job to look at those kinds of things that's happening and try to do things to make sure they don't happen in Lake Cumberland. Of course, we know we can't stop the spread of COVID-19. We're just wanting it to mitigate it. We don't want it to happen so quickly that the public health and medical hospital infrastructures get overwhelmed. The hospitals stay at about 70%, about 70% of their beds filled at any given time. And so there's, it's not as many hospital beds available as you think. I'm not suggesting we're in trouble at the moment. We're not. I hope I can say 4 or 5 weeks from now, we're still not in trouble as far as hospital capacity. I do know that the data shows when someone gets admitted to the hospital for COVID-19, they stay in the hospital for several weeks or months. They're not in and out in 2 or 3 days. So once those beds are occupied, they stayed occupied for a long time. So those beds can get filled up quickly when there's not a rotation happening of people being admitted and discharged. They get admitted and they stay. So that's kind of where we are through the week. Tracy, I'll turn it back over to you. Unless, Dr. Lynn, you have anything you want to add about just general observations? All right.
Okay.
So Tracy.
All right, I'm going to start the questions, and the first few are for you, Dr. Wayman. What is the norm when it comes to symptoms of COVID-19 for small children, and is public health seeing a difference in the symptoms in youth versus adults?
Studies show that most children either are asymptomatic, that means they have no symptoms, or have very mild symptoms. The symptoms usually are the same as in adults, meaning fever, cough, other respiratory symptoms, and fatigue. There is a rare complication, which is called the pediatric inflammatory multisystem syndrome. It is very rare, which occurs in children who have recovered. It presents with fever, gastrointestinal symptoms, conjunctivitis, rash, and swollen hands and feet. It is very similar to the Kawasaki syndrome. This condition is not contagious and is caused by an overactive immune system.
And so that's after they've recovered from COVID-19. Is that what I heard you say, Dr. Wayman?
That's correct. They usually totally recovered and then suddenly get sick again.
Okay.
And it's very rare. If they do get it, they need to be admitted and treated.
Okay, thank you. The next question is going to be for you also. If a vaccine was developed and ready to be provided to the general public, how long after development could we see the vaccine being offered in our communities?
From everything I have read, if everything goes well with the phase 3 studies, which are beginning in July and August, they predict that we should have a vaccine available in early 2021. That's about as much as I can tell you.
Okay, if you think you've been exposed or possibly at a doctor's appointment, or if you've traveled or at a gathering, how many days after exposure should you get tested? And if you get tested too soon, is it possible to receive a false negative?
Most people have to be quarantined for 14 days because the incubation can be up to 14 days. However, most people, if they're going to get sick, will do so in approximately 5 days. So if you are going to get tested, you should do it about that time. If the result is positive, it is helpful. However, if the test is negative, that doesn't help because that's just one point in time. And just because it's negative today doesn't mean it'll be negative, positive, will not be negative tomorrow. So I'm not entirely sure that testing people who are quarantined is necessary, but they certainly should be tested if they have symptoms, which is what they're monitoring themselves for.
Okay. How long after a deceased COVID-19 person is gone is it before it's okay to handle the items in their homes?
Okay, so I'm going to answer that question. It would fall right along with some other guidance we have for long-term care facilities who have COVID patients or hospitals. So the windows need to be open to allow for ventilation, and fans should be used to increase the ventilation. Then after 24 hours, you can go in and sanitize the surfaces using gloves, and you should also wear a gown, a disposable gown. You can use a 1,000 to 5,000 parts per million bleach solution, and the 5,000 would translate to 1 2/3 cups of bleach per gallon of water.
Okay, thank you, Stuart. Next question. Do people who traveled out of state for vacation have to self-isolate for 14 days when they return?
Okay, so as of right now, the governor has asked that anyone who traveled to the Myrtle Beach area, they should self-isolate when they return home for the 14 days.
And there's other states with different travel rules, but the only one that's in effect for Kentucky is for Myrtle Beach, and there's a reason why. There's been several specific outbreaks in Kentucky that's been tied back to Myrtle Beach. So that's the reason why they've selected Myrtle Beach as the only place to restrict, or that someone would have to self-quarantine if they come back from, because we've had actual outbreaks tied back to Myrtle Beach travel.
So Myrtle Beach area is the only one currently for Kentucky. Is that what I'm hearing you say?
Yes.
Okay. How do masks really work? If everyone wears one, are they pretty much protected? Does my mask really protect only others from me, or does it afford me some protection as well?
If you wear a mask, there is a degree of protection. However, it is really designed, that is a surgical or a cloth mask, are designed to protect the other person from your droplets as you speak or cough or sneeze. Hence, it needs to be placed over the mouth and nose. We tend to see a lot of people wearing them stuck under their noses, which doesn't really help. So there may be some degree of protection, but however, a person who was wearing a cloth mask and was in close proximity to a person who's positive still needs to be quarantined and monitor themselves for symptoms. If both individuals, the person with the disease and the person being exposed, wear a cloth mask, then the risk is probably quite small, but probably not zero.
Tracy, I noticed that in the chat there's a question. It's for Stuart. Stuart, did you see that and look up the answer?
And I
It says Blazum Bluegrass Festival is scheduled for September 17th through 19th in Macquarie County. This event is outside water. Are our guidelines for holding this event? Thank you. That was from Judge Greenan.
Okay, Judge. So on the Healthy at Work website, there on the June 29th order, we have requirements for venues and event spaces that are outside that are going to have greater than 50 people. So this would include fairs, festivals, carnivals, anything like that. One of the things you're supposed to do is limit the capacity of the event space to 50% of the maximum occupancy. Now, this is outside, so that may not come into play. I do want to say the biggest thing about this guidance on these festivals and such is you need to have everybody socially distanced. Of course, the promoters, anybody exhibiting, anybody that's there, maybe a vendor who's selling food or whatever, they need to follow their specific guidance. They also need to follow the minimum requirements. But for the festival itself, to ensure that contact tracing can be done, they have to have a way to register the attendees, whether it be through a registration process or a ticketing process, something like that. They have to be able to get the name and the contact information for the attendees at the event, whatever it is. So that would be maybe the hardest thing to achieve, but that is what the guidelines ask. And that is, again, in case that we do have cases that are at the event, in case there is an outbreak, that we can do the contact tracing through the health department.
Okay, next question is for you too, I think, Stuart. When can we have yard sales?
Okay, so we still don't have any guidance on that. I'm sorry. I know a lot of people want to do that, but you know, we don't have any specific guidance on yard sales as this time.
Okay, when can motel or campgrounds pools open?
So pools were able to open as of June 29th. They do have to follow the minimum requirements and the Healthy at Work guidance specific for the pools.
And this to ask about campground bathhouses also.
Yes. So campgrounds are allowed to open and have been for a while. Those bathhouses can be open, but they need to be sanitized frequently. Best practice would be after each use, but they do certainly need to be kept sanitized very frequently.
Okay. Next question. What are the guidelines for people with big bouncy houses or water slides as far as opening and renting those to parties for events?
Okay, so we know that parties and events are allowed with the 50 people gathering, also the events and venues. Now, as far as renting that equipment goes, that is allowed, and upon return, then that equipment needs to be sanitized before renting it out to the next group of people.
Yeah. Stuart, I could add to that. There's nothing magic about the number 50 or 100 or 10 or 5. Just because you're allowed to gather in groups of 50 doesn't mean during an epidemic it's a good idea.
That's correct.
You know, it's allowed, but if you're wanting to be safe, the rules about avoiding crowds, wearing a mask, keeping your 6-foot distance, you know, washing your hands, there's nothing magic about the number 50. It's only, you know, the governor wants the society to return as much normal as it can without overwhelming the medical system. So, you know, they're slowly letting more things happen. And you can look at what's happening in other states in the nation and see that some of the states who opened earlier, it's really kind of backfiring on them now. So, you know, I don't know what's going to happen in Kentucky. I would just say there's nothing magic about the number 50 or 100 or 10. It's just use good judgment. Keep your distance, don't be around crowds any more than you absolutely have to be. Keep your 6-foot distance, wear your mask, sanitize, stay home if you're sick, wash your hands, avoid touching your face. Same things.
Okay. Thank you, Stuart. Next one I think is for you too. It says, I own a dance studio. What do I do if I come in contact with a positive person in regards to closing or staying open?
Okay, and there may be some others who want to chime in on this, but I will say this, it really depends on if you've been in close contact and you're quarantined. So that's probably going to determine whether you stay open or not. I mean, do you have somebody else to run your dance studio if you become quarantined? So it's going to be there's going to be some individual things that would happen, individual cases that would determine that. So we'd have to look at that individually and see what all the particulars are of what happened.
Okay. Next question is from a daycare owner. I own a daycare. What do I need to do if one of the children or one of my staff develops COVID-19?
Okay, so when that happens, and that has happened, we know at least in Lexington, possibly Louisville, some other places, when you have close contacts, then you're going to be able to, or you're going to be quarantined and probably not going to be able to attend, either if you're a child at the daycare or if you're one of the providers, you're not going to be able to work. So what you do need to do is notify the parents of the positive case and assist the health department in contact tracing. Again, our tracers will look at that, and they will look at every individual situation of what happened and then make the determination.
Okay, thank you. Next has to do with restaurants. Can restaurants use real plates, silverware, and cups instead of disposable? And do they have to wear gloves, restaurant workers?
So yes, restaurant workers are required to wear gloves. They're required to wear gloves by the food code anytime they handle ready-to-eat food. And now, under the guidelines for Healthy at Work, the restaurants, they are required to wear gloves as they're passing anything between themselves and the diner. They can use real silverware, real dishware, provided they can properly sanitize that. And every restaurant that we have in our district does have means of sanitizing. So yes, they can use actual utensils and silverware and dishware.
And so what I also heard you say is not just the people who handle food, but everyone inside the restaurant that are workers are to wear gloves now. Is that right?
Yes, especially if they're doing something between the consumer. So if they're at the cash register, if they're a waitress, or if they're handling the ready-to-eat food, then they need to wear gloves.
Sir, can I add a question to that?
Yes.
We receive a lot of complaints when customers go into a restaurant and they see the staff that's in the back working in the kitchen, cooking, not wearing a mask, and they report that as a violation of the compliance. Will you clarify that?
Yeah. So remember the 6 foot social distancing. So if we have a person that's working in the back of the house in a restaurant on the grills, and they can maintain social distancing. Remember, it's super hot back there. This goes any place that it becomes a situation with the heat. As long as they're able to distance, then they are not required to wear the mask. Only when they come back out and they're around the diners or around the other people, the other workers maybe in the front of the house, the serving line, I guess you would say. Same thing I've had complaints of restaurant workers who are outside and they have their mask down. If they're outside and they're not around anybody else, then certainly they don't have to wear a mask at that time, or they can pull their mask down. Now, if they're delivering food to a vehicle, then they need to put their mask on.
In fact, if you're in the back cooking, the steam and stuff, if you've got on a surgical mask, can kind of ruin the mask
Yes.
pretty quickly.
Yeah, it's really hard to maintain a mask. Not only just the steam, the heat, the grease that comes up from those processes in the kitchen. So,
Okay. All right, next question also. When will nursing homes open so that we can see our family members?
okay, so there's two distinctions in nursing homes. There's a personal care home, and those can open on June 29th. Now, there's also what's called a skilled facility. So this is going to be the more of what you typically think of a nursing home. Those visitations will be able to start on July the 15th. Of course, you can't have more than 2 visitors. They're going to have to schedule these visits. They cannot be in the patient room. The people can't walk through the patient area. And also, the visitor will have to sign a personal attestation that they are following certain guidelines, that they are, for example, they're staying away from crowds when they're out, that they're wearing their mask when they're around people. So they're going to attest to that, to be able to go in that nursing home and visit. Nursing homes or long-term care facilities are one of the places that we have had an outbreaks, that we've had a lot of deaths associated with. So we need to be very careful with how we do that visitation. And I know that our nursing homes want to be very careful with the way they let people in to visit their loved ones. Not that we don't want, we do want people to be able to come in and visit their loved ones, for sure. We want that to happen. But we want that to happen in a controlled manner, and one that won't cause us more outbreaks or more deaths in these nursing homes.
It's a double-edged sword, Stuart. Obviously, if you've got someone in a nursing home and they're reaching the end of their life, you know, and they're your loved ones, you want to be able to spend quality time with them, and you know, we truly understand that. I can tell you, there's nothing that's more frightening to me than opening the nursing homes back up, only because we've seen how it can devastate a facility and send a lot of them to the hospital, which really shuts down a lot of the hospital's capacity, and then there's a lot of mortality that goes along with it. This is a tough disease where you can be spreading it without knowing you have it, and that's how it gets in. So, you know, it's a double-edged sword. Hopefully, things will go well, but it's a tough one.
Now, I will say, of course, when it comes down to the compassionate care, at the very end stages, then there are some other, there's allowances for that. So that would be different than the normal visit.
Okay, thank you all. Next question is going to be for you, I guess, Sean. Can you tell me who is positive in the counties? Can we share that information? I guess is what they're asking.
Now, you know, HIPAA, the Health Insurance Portability and Accountability, protects patient confidentiality, and we can't reveal individual names of positive cases.
Okay. Where can I get signs for my stores that says stop sick, wear a mask? What about signs for the floor also that talks about social distancing?
Yeah, those signs are available on the Healthy at Work website, covid19.ky.gov.
Okay. Next question. Can we have a wedding with family members and friends now?
So Yes, we have the event and venue guidance that I spoke about earlier, that would apply to weddings. Then we also have the guidance for the 50 people or fewer. And of course, please remember, adhere to the rules of social distancing, the mask use, and sanitization and hand washing. So, and we would ask that people that are in more vulnerable categories, whether it be sickness or due to age, that they would avoid those gatherings.
This is not tied to that question directly, but it again kind of gets to the gatherings. We've been looking closely at the vector of all the vectors, but I'm thinking specifically about churches. Something that we've seen is we've had positive folks who are positive with COVID-19 attend church. And in every single instance so far where the churches were observing the social distancing and the masking, that case, having went to that church, did not turn into an outbreak. And in the instances where the case that went to church, it did turn into an outbreak, were situations where the social distancing and the masking was not happening. So if you're going to be having events like weddings, remember, keep your distance, wear a mask. It makes a big difference. It makes a big difference. And like I said earlier, there's nothing special about the number 50 or the date, June 29th. You should still take precautions.
Okay, next question. What are the temperature guidelines? Do people have to have their temperatures checked as they enter stores?
So no, people don't have to have their temperatures checked as they enter stores. However, the store is allowed to put those requirements in place if they want. A store can say, no mask, no service. A store can check temperatures of folks coming into the store if they want. Now, I would want to say that does not apply to the employees of the store. They are required to have temperature checks. Those can be self-administered, but they are required to have the temperature checks before their shift.
So stores can voluntarily say, hey, wear a mask, and I'm going to take your temperatures. Okay. So what is the cutoff temperature for stores who, I guess these are for employees that are taking their temperatures, Stuart?
So that's 100.4 degrees Fahrenheit or above.
Okay. Next question.
Actually, let me add, they can't actually set a temperature below that. They just can't exceed that. So if they wanted to set their cutoff at 100 even for their employees, to send their employees home, then they can do that. They can be more restrictive, but they can't be less restrictive.
Okay. What should we do about going to church?
As of June 10th, churches were allowed to come back together again, of course, and then right now they're able to come back at 50% according to the recommendations. When I say allow, recommended that they come back together at 50% of their pre-pandemic capacities. Anytime you go to church, you're in a confined area. Please, please wear your mask. Everybody wear your mask. Make sure that you distance. Wash your hands. Sanitize your hands. If there's another way, such as the outside service or the online service, that's the better option. We have seen many cases tied to churches. So anytime that you're inside and you're breathing recirculated air, you're singing, especially if you're not masked, then those places are a really good place to end up spreading coronavirus.
And up until the situation we're dealing with today, we really hadn't seen, restaurants being a real vector for the case. Now, that might be changing today. So, you know, of course, restaurants haven't been really, they've been mostly doing carry out and drive through. So now that you're starting to get some go in and sit down situations happening, today may be our first situation where we have a significant number of cases tied back to a specific.
That's correct. And, you know, thinking back to when, this first started for us back in March, and all the way really through, Memorial Day on to just very recently, we've not had cases of employees in restaurant food service facilities, but we are having that now. I think we have 5 or 6 facilities that have had positive employees. So that is a vector and a metric that we are watching that closely now.
So
Yeah.
will you all explain vector, please?
It's a location of it's the epicenter of an outbreak. It's like a hospital or a nursing home or, a certain event. Or it could be more general, like saying a travel, just generally that people that travel might be a vector, but it's generally thought of as a specific location where something happened.
It's really the person that's spreading the disease. He's the vector of the virus. The index case in your outbreak.
Okay, thank you all.
Yep.
All right, are we ready for the next question? We have several
I think so.
questions today. Okay. Can we have our continental breakfast at the motels now?
Okay, so yes, you can do that. We talked about the restaurants allowed to have 50% capacity, and there still needs to be the seating arranged in a way to social distance from others that are not your household contacts. So you can have seating and you can have the continental breakfast. However, there is a caveat. You cannot have people self-serve. You will have to have someone to serve.
That's what I was wondering about self-serving buffet style. Okay. So they can do that, but they need to have someone that's serving them from for the dishes. Okay.
Yes.
When can restaurants have 50% of their patrons?
It looks like that's on June 29th that the restaurants could seat up and go up to the 50% of the maximum permitted occupancy. I will tell you that bars have been attributed to many outbreaks in other states. If you watch the news, you'll see that. So even though, as Sean has said, even though that something's allowed, doesn't mean that it's the best. So you need to really be careful when going out into the type of environment where people would crowd together and are possibly not wearing their masks. So yeah, just be careful.
Okay. The next question says, I share custody with my ex-wife. What if she is a contact of a positive case? Do I have to let my kids go home to her on her days?
Okay, so on that, I need to explain something just a little bit first. What's a primary and a secondary contact? So a primary contact is the person who came into contact with the actual case, the person that has COVID. Now, a secondary contact would be the contacts of the contact. So, for example, if Sean has COVID and I come in contact with Sean, then I'm a primary contact. But my kids, when I go home, are contacts of mine. Well, they're secondary contacts. So in this case, I think we're talking about secondary contact, which we don't quarantine those, or you could call that an indirect contact. But in addition to that, you do need to ask the court in regard to any changes in a custody arrangement. Just because that we're in a COVID situation, that is not going to potentially override what any arrangements in custody have been made.
Okay. Next question. Do people have to wear a mask if they work behind a piece of plexiglass?
Yes, they do. And the reason being is you'll find gaps in that plexiglass. And this is, I don't want to call it, I don't think it would be right to necessarily, Dr. Wayman can correct me here. And is it an aerosolized disease? It's more of a droplet. Yeah. But when we're talking, then that comes out and, you know, it kind of gets around things. So, I mean, you don't have to be spitting on someone that you can visually see to be projecting out these droplets as you talk. They're fine. So yes, you do still have to wear a mask when behind a piece of plexiglass.
Tracy, I see we're getting close to the last couple of questions. I'll just remind there's 53 people watching live. If you have something you want us to try to answer, the time to type that in the chat boxes now.
And we already talked about wearing masks at restaurants. So, but here's another question. Do people have to wear a mask at work is what it asks here. So I think this is more talking just in general, Stuart, okay?
Yeah. If you work in somewhere, if you cannot distance, then yes, you have to wear a mask. That goes for any type of business that you're in. You do have to wear a mask. Now, if you work outside, as long as you're not within 6 feet of your fellow employee or customers, let's say you work on a construction site, then, you know, and you're running the jackhammer. No, you don't have to wear a mask because the next person's probably not standing there right on top of you. I mean, they're going to be 6 foot away from you. If you're a mechanic at an auto dealership and you've got your head down in the engine and you're working on a vehicle and the next vehicle's over next to you, then no, you're not going to have to wear a mask. You're able to maintain those 6 foot distances.
Okay, thank you. How many active cases are there in the counties?
Well, as of this moment, active cases, now this is the way we determine active cases. We take the total cases, we subtract everyone that has recovered and been released, we subtract everyone that's deceased, and the leftover is what we call active cases. So active cases, Adair 17, Casey 9, Clinton 1, Green 1, McQuarrie 3, Pulaski 11, Russell 9, Taylor 12, Wayne 4, and it looks like we'll be adding Russell, Adair, and Taylor cases today, several in Adair. It looks like Taylor last week was our hot spot. Looks like maybe Adair this week is going to be our hot spot. Just so you know, every single day we release the list of total cases and we release a list of active cases, not by name, but just their where the active cases are, the new cases are, which counties, if they're in the hospital or not, if their symptoms are active or not, their ages and genders, those kinds of things. We release that on our Facebook page. We release that on our under the news section of our website homepage. So you can always keep up with that. There's lots of different COVID-19 statistics on our website. If you click the main banner, when you go to our homepage, it'll take you to where you can see all kinds of additional statistics about our district.
Okay, thank you, Sean. Are there any questions that you see out there, Sean?
I don't see any other questions in the chat box, so I'll start just closing us with the same comments that I've been making. There's nothing magic about a certain date or the number 50 or 25 or 75. You know, the more that you're around other people, the more that you're not or they're not and you aren't wearing masks, the more you're in confined space with people, all of that creates risk. Just your chances are higher the more people you're around. So, you know, social distance, wear your mask to protect others. Certainly don't go out if you're coughing or have a fever. Make sure you're sanitizing and washing your hands more. Those kinds of things we've been suggesting. And remember, we can't stop COVID-19. Mother Nature is going to win. We just don't want it to. We would rather it be like the tide coming in at night instead of a tidal wave coming in. A tidal wave would mean that the healthcare infrastructure would be overwhelmed, and it doesn't matter what kind of care you need. If the system's overwhelmed, it's going to be difficult to get care, regardless if it's COVID-19 related or not. So I didn't see any more questions come in, so Tracy, I'll let you sign us off.
All right. I want to say thank you all for joining us today. If you have questions, please send them our way, and we'd be glad to answer those next week on our call. We will be here next Wednesday at 2 o'clock Eastern Standard Time. Thank you all.
Thank you all. See you next week.